Dear colleagues of the Kazakistan Ateroskleroz Society, I'd like to express my sincere thanks for inviting us from the EAS. Today I will discuss the heart-brain metabolic axis and its role in the prevention. As you know very well, cardiovascular health, metabolic health, lifestyle factors are all strongly connected with brain health. Understanding these connections can help us to prevent both the cardiovascular disease and the cognitive decline. The relationship between heart and brain is complex and still not fully understood. The heart and brain communicate continuously and bidirectionally through the neural, hormonal, immune, and vascular pathways, and these pathways regulate the cardiovascular function, cognitive function, and the stress response. A well-known example is Takotsubo cardiomyopathy, also known as the broken heart syndrome. This condition illustrates how acute emotional stress can directly affect cardiac and also microvascular function, leading to transient left ventricular dysfunction and the characteristic apical ballooning. Psychological health is closely linked to cardiovascular disease. In our cohort of patients with homozygous FH, we reported higher levels of depression, anxiety, and stress. And the mental health problems were also associated with lower physical activity level in our cohort, and this highlights the importance of addressing both the mental health and the cardiovascular health. The latest EAS guidelines on dyslipidemia highlight that psychological and mental health conditions can also contribute to cardiovascular disease risk, and to increase awareness of this connection, the ACC last year published a consensus document focusing particularly on the relationship between the mental health and cardiovascular disease, emphasizing how these factors can coexist and influence each other. The heart-brain metabolic axis describes a close and a dynamic connection between these three systems. When one part becomes dysregulated, for example insulin resistance, it can trigger a chain reaction, leading to processes like inner inflammation in the brain and endothelial function in the heart. Understanding this axis is extremely important, as it will help medicine move away from targeting organs separately and toward a more holistic system biology approach. Inflammation plays a central role in both atherosclerosis and brain disease, and neuroinflammation involves the inflammatory process in the brain driven by cells such as microglia and by cytokines like IL-1 beta, IL-6, and TNF-alpha. Oxidative stress and inflammasome activation also contribute to both vascular disease and neurodegeneration, and together these pathways link atherosclerosis with cognitive decline. Lipid metabolism is also important for both cardiovascular and brain health. Cholesterol transport and lipoproteins influence vascular function and the neuronal activity, and disruption of these pathways in terms of high LDL, high Lp(a), and so on contributes to atherosclerosis and neurodegeneration. 90% of the strokes and 40% of the Alzheimer disease are associated with modifiable risk factors. Especially in Alzheimer disease, hypertension and vascular damage accelerate pathological change in the brain, and this shows why vascular prevention is also important for brain health. According to the Lancet Commission report, almost 50% of the dementia cases are linked to modifiable risk factors. These include physical inactivity, smoking, obesity, hypertension, and depression. As you can see here, high LDL is the second most prevalent risk factor in midlife after hearing loss. Now I want to focus on ApoE. It's an important role both in lipid metabolism and brain function. In the brain, ApoE mainly produced by astrocytes, and it transports cholesterol to neurons for synapse formation and repair. It also regulates the lipid uptake through LDL receptors. ApoE has three major isoforms. ApoE3 is the most common natural form. ApoE2 is associated with receptor reduced binding, leading to type 3 hypolipoproteinemia associated with premature atherosclerosis, and ApoE4 is important for Alzheimer's disease. ApoE4 is accepted as the strongest genetic risk factor for late onset Alzheimer's disease, And having one ApoE4 allele increases the risk about threefold, while having two alleles may increase the risk up to 12-fold. ApoE4 contributes to Alzheimer's disease through several mechanisms. It reduces amyloid beta clearance, increases neuroinflammation, and causes mitochondrial dysfunction. Together, these processes accelerate neurodegeneration. Other than lipids, metabolic disturbances contribute to long-term brain disease. Diabetes is a well-known risk factor for Alzheimer's disease and dementia, and in patients without diabetes, even the postprandial hyperglycemia may increase the Alzheimer's risk in midlife, and this is shown in the Mendelian randomization studies from the UK Biobank. A recent study from the UK Biobank also showed that for 13 years follow-up, achieving and maintaining both the metabolic health and the normal weight are critical for optimal long-term brain health. Another UK Biobank study with 14 years of follow-up showed that there is an escalating dementia risk across the cardiovascular, kidney, metabolic syndrome stages in terms of structural change in brain checked with imaging. Sleep disorders are also independent risk factors for cardiovascular disease. Poor sleep, short or long sleep duration, and obstructive sleep apnea can all increase cardiovascular risk. As sleep disorders are very common, it is estimated to affect half of the general population. As physicians and cardiologists, we should recognize their important impact on cardiovascular health. Studies have well shown the U-shaped relationship between the sleep duration and the cardiovascular disease, and it is now well known that both the short and long sleep duration increase the risk of stroke and dementia. The reason is that sleep disturbances promote oxidative stress and inflammation, leading to neurodegeneration. Obstructive sleep apnea is associated with atherogenic dyslipidemia. In our cohort of more than 2,000 patients with obstructive sleep apnea, non-HDL cholesterol was increased with the disease severity. This suggests that non-HDL may be a useful cardiovascular risk marker in sleep apnea patients. Another large sample-sized UK Biobank study revealed that higher omega-3 levels in midlife are associated with lower risk of early onset dementia, and this supports the role of diet in brain health. A recent meta-analysis of 45 studies involving more than 700,000 participants showed that the greater adherence to the Mediterranean diet is associated with a lower risk of Alzheimer's disease, mild cognitive impairment, depression, and Parkinson's disease. The MIND diet combines the Mediterranean and DASH diets with special emphasis on brain protective foods such as berries and green leafy vegetables as anti-inflammatory diet. And there is a growing body of evidence suggesting that both the MIND and the Mediterranean diets may support neurological and mental health. Evidence linking diet to cognitive decline is rapidly growing. The gut-brain axis is also important. Gut dysbiosis can promote inflammation, affect vagus nerve, and also disrupt the blood-brain barrier. Together, these changes may contribute to cognitive decline. Evidence suggests that a pro-inflammatory diet may accelerate brain aging independent of the ApoE4 genotype, particularly in older adults. High-fat diet has also been associated with cognitive dysfunction. Like diet, physical activity has a strong protective effect on brain health. High levels of physical activity are associated with an almost 50% lower risk of Alzheimer's disease, but even light activity is also beneficial, and importantly, exercise may reduce risk even in people with high genetic susceptibility. Importantly, the protective effect of exercise appears to be independent of ApoE4 status. This means that physical activity may benefit everyone, regardless of the genetic risk. Another key message is that even light physical activity can be beneficial. Maintaining regular activity over time may significantly reduce Alzheimer's disease risk, and making exercise a simple and accessible prevention strategy. This large UK Biobank study showed that combining healthy lifestyle factors, that is, physical activity, muscle strength, less sedentary time, and good sleep, was associated with a lower risk of both stroke and dementia. Importantly, this benefit was also seen regardless of the genetic background. So the key message is that multiple healthy behaviors together can protect both cardiovascular and brain health. Another research from the UK Biobank examined the relationship between the physical activity and air pollution exposure and showed that higher physical activity was associated with lower risk of both Alzheimer's disease and vascular dementia, with an even stronger protective effect against vascular dementia. And importantly, these findings also show that physical activity may help mitigate some of the negative effects of air pollution on brain health, highlighting the importance of both active lifestyle and environmental health policies in dementia prevention. There are two important initiatives about multi-domain lifestyle interventions. The first one is the FINGER study conducted in Europe. It's a 2-year multi-domain lifestyle intervention in older adults. And it showed that the lifestyle intervention can reduce the risk of cerebrovascular and coronary events, including stroke, especially in people with a history of CVD. The second one is the US Pointer study, which showed that a structured multi-domain lifestyle intervention can improve cognitive function in adults over the age of 60 years. The key message is that structured lifestyle support may help preserve brain health as we age. Acute ischemic stroke is also important in the development of post-stroke dementia. It's a major cause of death and disability worldwide, and the survivors remain at risk for not only recurrent stroke and cardiovascular events, but also post-stroke dementia, neuroinflammation, oxidative stress, amyloid accumulation. All may contribute here to this risk, and therefore both the acute treatment and long-term prevention are essential for the prevention of post-stroke dementia. Statins reduce the mortality rate in acute ischemic stroke patients. The accumulating evidence denotes that statins should become the cornerstone of secondary prevention of acute ischemic stroke. Data on the statins' effect in improving cognitive outcomes after acute ischemic stroke is also increasing. PCSK9 inhibition may also help to regulate neuroinflammation, especially in patients with acute ischemic stroke. Well, importantly, long-term studies with evolocumab show that achieving very low LDL cholesterol levels is not associated with significant cognitive harm. Growing evidence from animal case control randomized studies suggests that PCSK9 may become a potential therapeutic target in the prevention of Alzheimer's disease. Currently, the most popular drugs are GLP-1 receptor agonists, and they are important agents, as we know very well, to improve the glucose control and reduce systemic inflammation and endothelial dysfunction. They may also have neuroprotective effects by reducing inflammation in the brain. Large cardiovascular outcome trials show that these agents provide vascular protection, reducing the risk of atherosclerotic cardiovascular events and stroke. They especially prevent the acceleration of atrial cardiomyopathy and subsequent embolic events, often driven by the metabolic syndrome. This is a very important topic, that these agents may also reduce the risk of depression, support behavioral health, and provide cognitive and neuroprotective benefits. Their neuroprotective effects are being studied not only in Alzheimer's disease but also in Parkinson's disease, with very promising results. A recent meta-analysis suggests that GLP-1 receptor agonists may reduce the risk of vascular dementia, with a more pronounced benefit in people with type 2 diabetes. As a conclusion, the heart, brain, and the metabolic system are deeply interconnected, And not only LDL and lipids, but also lifestyle factors such as diet, physical activity, sleep, and metabolic health play an important role in prevention. Integrating cardiometabolic and neurological prevention, including lipid-lowering therapies and GLP-1 receptor agonists, may help to improve long-term cardiovascular and cognitive health. Thanks for your attention.